Dear friend Rotarian, thank you for your visit to the booth of the Rotary Action Group for Addiction Prevention. My name is Johan Maertens. I am the chair of the scientific committee, and I was also one of the founders of the Rotary Action Group in 2012. I will explain you something about how the Rotary Action Group supports clubs and districts for local actions, also for regional or national actions. I will also tell you something about the global grants we help clubs and districts to set up. Also for addiction prevention actions in other countries, in cooperation between countries and districts from several countries. I will also tell you something about our cooperation with NGOs. We work together with professional prevention NGOs, and I will tell you something about that. I will also explain you how our scientific committee is making sure that what we do is scientifically approved and evidence-based. And I will also tell you something about our cooperation with the international offices. Let's start with the support to the clubs and the districts. Of course, the first and the most important goal is that we can help Rotary clubs to set up local prevention action. To support this, we developed a toolkit that's a complete video-supported toolkit that helps you step by step in all the aspects that are important to set up a structural long-term action in addiction prevention. Should be structural and long-term, because otherwise it is counterproductive. So this toolkit is available. You can order it with us, and of course, it contains several videos explaining the history and the backgrounds of tobacco, alcohol, illicit drugs, opiates, cocaine, and so on. Furthermore, it gives you all the steps a Rotary Club needs to consider before taking action in the field. So for all those information, all this information, you can reach us at our website. I will show you later also the coordinates, and you can find them in the booth details. That's the first point. Of course, when we try to implement evidence-based prevention programs, then we need always as a partner a professional NGO in your region. Therefore, we have international cooperation agreements with the international prevention NGOs who have, of course, local chapters, maybe also in your region. So we can also help you to find the respected and professional NGO that may become your partner for your prevention activities. We have global agreements for cooperation with the World Federation Against Drugs, with Dianova International, with Movendi International, and several others, sometimes international, sometimes locally. The work we do with the NGOs is in two ways. NGOs are informing us about the Rotary clubs they are working with for addiction prevention, and that we don't have contact with, so they can help us to find our fellow Rotarians already active in this field. On the other hand, we can help them to bring their local chapters in contact with, for instance, your club, your district, for further cooperation. So this is really a win-win cooperation between the professional NGOs for prevention and the Rotary Action Group Addiction Prevention. Besides and in the cooperation with NGOs, clubs and districts, we come to my third point, the global grants that we help to set up, to organize. So in the global grants, we always mix three aspects depending on the local needs. In the first step, we always try to adapt existing and evidence-based prevention programs to the local language, culture, and needs. This first step, there's always a cooperation with a university that follows the whole process of the adaptation, or even for the creation of new adapted programs. That's the task of a university in cooperation mostly with an NGO that will perform the training to train these new adapted or developed programs, to train them to trainers that then again will train teachers, social workers, health workers to deal in a better and a more professional way with addiction prevention. That's the first phase. Second phase is the training, and the third phase is the second phase is training of the trainers. Third phase is training by the teachers, social workers, field workers to their clients, pupils, students, drug addicts, families, parents, everybody is involved. It's also an important thing to mention. When we develop those programs also for global grants, we always aim at involving the parents and the community. So it's not only the pupils or the students from a school, it's also about their parents, and it's also about their community. So the global grants are very important because they help us to spread and to develop and to spread and to integrate new adapted programs in local activities of Rotary clubs, schools, and so on. The sustainability is very important also in global grants, but of course in all what we do, we prefer sustainability. And therefore the cooperation with universities is very important, because we always ask at the university that is paid for the development, the evaluation and the research on those new programs. We always ask them as a condition that they will integrate the training program then in the curriculum of the masters in psychology, social work, mental health professions, medical professions, and so on, so that it keeps going on, that it has a good follow-up and a permanent adaptation for the future. So that's what we do with the global grants. And another important aspect, and that's the fourth point I want to explain to you, is our scientific committee. As we only want to work with evidence-based programs that have proven to be effective in the field with the target group we are looking at, we started and organized also a scientific committee with you can find the members of the committee on our website. And these are professors of universities that were already involved in the development of evidence-based prevention programs for many years. the first vocational training team for the university in Mumbai, for instance, dates already from 2012. The scientific committee is looking at every global grant project and is studying and evaluating the content of the project. So we, as a RAC, Rotary Action Group for Addiction Prevention, when we are a partner in a global grant, we can assure and guarantee that the project is evidence-based and that the follow-up at the scientific level, not only by the university involved in the program, but also of many universities gathered in our scientific committee as a third scientific party or looking at the quality of those programs. So if you partner with Rotary Action Group Addiction Prevention, you're sure about the effects and the results of your program. Also, our evaluators from Rotary International who need to study and to agree to approve the global grants that we promote, they can be sure that the content, because it's very specialized, has the scientific supervision that is needed. And then the last point that I can explain to you is the role of the Rotary Action Group Addiction Prevention at the international level in cooperation with the international offices. We are in the process to become a partner of United Nations as a partner in ECOSOC, that's the Economic and Social Department of the United Nations. This process is going on, and we expect the results of our accreditation still this year. More cooperation we have with UNODC, that's the United Nations Office for Drugs and Crime, that holds a yearly conference with all countries and all NGOs involved in drugs, drug addiction and drug prevention. We are present there, and we have a global agreement for cooperation with UNODC, in which we specifically cooperate to implement the parental communication and training programs from UNODC in the global grants that are supported by our action group. So in any program, we involve the parents based on the programs of the UNODC Department of Prevention. Then we also have a specific cooperation with WHO. WHO gives special attention to alcohol abuse in groups. And as we may say, Rotary, in some of our clubs, we have a problem with alcohol abuse in the club by certain club members, by certain groups in the club, and we are not always very alert on seeing the damage or the problems that are behind these addictions or members with alcohol problems. So we are developing a cooperation with WHO to implement their program for prevention for alcohol abuse in groups. And we Rotary clubs, we will be our own test case. And once we get through the test with our clubs, then we will implement that project for groups further in cooperation with other NGOs. But first, let's look at ourselves and at our own health. Important also for our families and our children. So that's the WHO. And of course, we are also looking and we are open for other cooperations at the international level, which maybe you have some suggestions for. Before ending this short introduction, I will show you also our leaflet or flyer, and I will leave it here. You can find our website over here. You can also scan the code, and this is the info address at rag.ap.org where you can reach us. This information is also available in the print of our booth that you can make. And please contact me or Kathleen, who is also in the contact information, and we will come back to all your questions, and we can meet with Zoom at the moment that we can agree on. Thank you for coming. Thank you for visiting, and I hope to meet you at Zoom very soon. Thank you. Bye-bye.